Hey guys, my name's Sam and welcome to PrepMedic. After 2 years of being on the Special Operations Response team in my area, I think I have finally figured out how to pack medical supplies for search and rescue missions. And today I'm going to share it with you. Our Special Operations team attaches to 2 SWAT teams, a search and rescue team, and dive rescue. Since I started on the team, I have really struggled in the search and rescue territory because I haven't known really what to pack or how to pack the medical gear. Trying to balance sustainment items with ALS capable medical gear has been a huge challenge, and there's not a lot of backpacks or kits that are really designed for that role. You have people that like to take a ton of supplies and people that are very, very minimalist on our team, and I find that I fall somewhere in the middle. So this has gone through a couple different evolutions for me. I started out trying to do both the SWAT kit and the SAR kit in the same bag. That was actually the RATS pack right here, and that was just absolutely monstrous for both applications because I was trying to keep too much in it, try to keep everything I needed for both roles. Then I went to a really minimalist setup where I took everything I had for medical supplies and I just kind of threw them in a hiking backpack and went, and I really found that I didn't have some equipment that I really wanted and it wasn't organized very well for rapid access. That all has brought me here to this pack. Now, the pack in front of you, I got, and I was intending to do a review on the kit itself. This is the Tasmanian Tiger Mark II Medic Assault Pack Small. And I was really just gonna do a review on this and then probably throw it in storage or do something else. When I got it though, I realized that this had a lot of other potential and I didn't waste any time and I spec'd it out for exactly what I wanted. So this is a relatively small medical bag. You can kind of see compared to my hand. I've reviewed IFACs bigger than this. I think the MyMedic kit is just a little bit larger. And this is substantially smaller than my SWAT kit. The whole thought behind this is that it is kitted out to deal with your bleeds and traumatic injuries like that from falls or other accidents in the backwoods, but mainly it is designed to treat orthopedic injuries and some other things we might see in the wilderness environment. What I really like about this is this kit here can store its handles in the back, so I don't need those out. I can take my search and rescue pack, which is this is a Hill People Gear pack, and I can just strap this to the outside of this kit, which has all of my sustainment supplies. It has my extra layers, water, food, everything that I would need as part of the search and rescue team. This will just add to some of its capabilities. So I can strap that on that backpack or any other backpack that has cinching straps on the side. All else fails, I can always just carabiner it to one of the lifting handles of a third-party pack if we're trying to split loads or I'm using something that I'm not used to. I can just take this and put it in there. I love this thing. I'm super happy with how this turned out. I'm still kind of playing with it, so not everything's gonna stay the exact same. Starting with the outside, as always, up here we've got a pair of X-shears. X-shears are my favorite scissors. They're pretty lightweight, they're very simple. They don't have all the doohickeys that your Raptor trauma shears will have. So these have been a favorite for a long time. That just fits in this pocket. I have just a really tiny beacon on here. It's just a source of light I can put on if somebody's looking for me, or I can mark a trailhead. It was basically just something to fill up the Velcro there. Identifier down there, really not a big deal. And then on either side we have a tourniquet over here. Now this kit isn't really kitted out as a tactical kit. I still carry all the major bleeding supplies, but realistically in the backwoods, if we get to somebody and they haven't bled out, that's probably not going to be an issue for us because it takes us, between an hour to 3 hours to get to somebody on average, depending on where they are. So usually the major bleeding, unless they've done their own makeshift tourniquet or something that's worked, it's not gonna be a huge concern for us. I still have everything that needs to go into that March algorithm though. Now, on the right side of it, I have the Schlissman I always say that name wrong, traction splint. So this is a very, very small traction splint. Like I said, this kit is specifically designed for orthopedic injuries. This is for your mid-shaft femur fracture. Somebody can lose a lot of blood there. We have a lot of climbers that fall, so those bone breaks are pretty common for us. I really wanted to have something where we could treat that femur fracture if we had to, because that's a pretty big deal. In the front pocket, and this is packed pretty tightly because I've got a lot of stuff on the inside, I have two things. So number one, I've got the Sore Rescue MedMag. This has, basically it's their pill pack, and this has acetaminophen, ibuprofen, diphenhydramine, loperamide, bismuth, multi-system cold, burn cream, triple antibiotic pack, hydrocortisone pack, Band-Aids, and eye drops. So it's kind of all of those little over-the-counter things that you might need. Just good to have in these kits because not everything you're going to is like the super serious life-threatening thing. And then in the top, if I can get it out, we have a SAM splint. So I don't carry SAM splint with my SWAT stuff. And like I said, this is pretty tight. There we go. So the SAM splint is just for those breaks. This can be used on legs, arms, hands. It can even be turned into a makeshift C-collar. So there's a ton of different uses for the SAM splint. And that just goes right on the outside pocket. It's kind of where it fit the best. And then the pill pack just goes right next to it. I'll try to leave links down below to all of these kind of off-the-wall products that I have, because a lot of these are just things I've gotten over the years. I really like the Sore Rescue MedMag, so. Coming into the kit itself. This thing is pretty tight, but I find that it actually works pretty well. It closes easily. Somebody's gonna be like, you can't even get it closed again. I definitely can. So, inside this kit, I have this, really not laid out in any particular like order in March algorithm, because in the environment we're in, I can take a little bit more time to get in here and get exactly what's needed for the patient. One of the really cool things about this kit is these panels actually will come out, and these just have these elastic bungees on them, so you can kind of customize them how you want. I honestly left this laid out exactly as it came in the package because it worked for what I needed. All right, so in the lid of the pack here, I've got a number of things. So I've got these peen hemostats, great for some minor surgical procedures, your finger thoracostomies. It can assist with a surgical cricothyrotomy, can also be used as like tweezers or getting a thorn out of somebody. We do have cactus in the Highland Desert here. Below that, we have the NAR survival wrap, and that's just a hypothermia prevention kit. You still need to insulate the patient, but I carry some extra layers I can throw on them in my search and rescue pack that can be used in conjunction with this while we're waiting for evac. I've got two little plastic baggies with gloves in them, and then I've got my hyphen chest seals, just the twin pack in there. I like them because they're super, super compact. Now, up in the lid here, I've got the NAR compressed gauze. This is just for wound packing. It can be used as wrap. It can be used to wrap the splint on. I've got some other stuff for that. It can be used to wrap a head wound. Just really multi-purpose and really cheap. So it doesn't take up much room and it doesn't weigh anything. So I like to have that in there. Next to it, I know you guys are gonna have a coronary. I don't usually carry Elias or Olays bandages, however you like to say it. But here, I decided that multifunction was kind of the name of the game. So this guy has like an eye cup in it. It's got a little plastic sheet, can be used as an improvised chest seal if you absolutely have to. But mainly it is a pressure bandage. It also has some gauze you can use for wound packing as well. So I like the fact that it's multifunction. Just put it in here. Its form factor isn't super conducive, but it fits in the pack, so I'm not complaining. Right here, I've got combat gauze. That's for your wound packing. That's a hemostatic agent. Now, in contrast to this is like 45 bucks. The difference between these, this will stop bleeding a little bit faster, but there hasn't been any data to show that this actually makes a difference in long-term patient outcome. So in this situation, compressed gauze is gonna work pretty well if you can't afford to go with something like this, or if your agency doesn't have this combat gauze, you can go with something else. Now, on this side, I've got a thing of saline. Now this guy here, I have shrunk wrap. I took it out of its original packaging in the bag, and you have to kind of follow your department's policies and procedures for something like that, because it does technically break that sterile field on the inside, but it still has its cap in there. So that's still on, that's still sterile, and then I just put a 20 drop set behind it and vacuum sealed them together. The reason I did that was because there's actually a lot of air in that baggie. So it's nice to be able to get it out and it just packs a little bit flatter, especially for an application like this. So as we move on to the lid contents, I got a couple things in here. In here, we've got the micro BVM, the pocket BVM. You might save a little bit of space taking out of the container, but because this isn't something I use a ton and I'm always in these kits, I like to keep it in the container just to keep it from getting damaged. Now this is a bag valve mask, which is pretty cool. You open this up and then you can breathe for somebody. We're only gonna do the bag valve mask respirations for a short period of time until we can get an eye gel or a surgical airway realistically. Or if somebody's like just having difficulty breathing, we might assist them for a time. Wilderness environment, it gets a little bit difficult to do. So that all packs down in here. It's better than mouth to mouth or mouth to mask. It's just a lot cleaner. So staying on the airway theme over here, I've got a vacuum packed eye gel. So these are a supraglottic airway. I really don't think it's that realistic for our team to carry like a full intubation kit. We can carry that out there, but if we're doing that, I'm gonna need more than just this kit here. So this is just supraglottic airway. It makes it easier to bag somebody, goes down their throat and sits, and it protects their airway slightly. And then below that, I have a North American Rescue Crike kit. So this is a bougie introducer with the Crike tube in there that we can cut somebody's throat and put that in if maybe they still have a gag reflex or if it's massive facial trauma, something like that. We have a backup airway besides just the eye gel here. So that all fits pretty well in here. The eye gel, if you're carrying one and you can vacuum seal it, do so. The packaging keeps it really, really big and rigid and it just kind of sucks. So if you can pull it out of there, vacuum seal it, you're good to go. But once again, it's technically not sterile at this point. Not that anything is sterile in the pre-hospital environment. Your agency might just take issue with it, however. In here, I've got a scalpel in the side. It's got these cool elastic loops on the side. So I just have a scalpel in there for the surgical cricothyrotomy. Also, you can do a finger thoracostomy with that, you name it. And then I've got a 28 French NPA. This one's gonna be hard to get back in on camera. Just a 28 French NPA in there to secure the airway. You can do that with anybody. I don't carry OPAs because gag reflexes, I just don't use them in my practice all that much. So I kind of stick with the NPAs for almost everything. Middle of the kit, I am carrying a black diamond headlight. Now this is extra from what I carry in my other kits. This is just to make sure that anytime I'm deploying with this, if maybe I just grab this kit because it's not that far of a hike, I have something to work in the dark. You know, it gets dark quickly, and if you don't have a headlamp, you're more of a liability to your search and rescue team than anything else. And that just kind of free floats right there. On this side, I've got elastic wrap, and this is more for like securing the splint to the arm or wherever we're putting it. It can also be used as a compression bandage. And then I have two just triangular bandages. Old school guys will call these cravats, and these are for your slings, swaths. You can wear them as a bandana, face mask, tons of uses for these. And in this environment, I think they're really important to have because orthopedic injuries, somebody falling down with a backpack on their back, bracing with their hands, is pretty common where you'll have clavicle injuries, wrist injuries, humerus injuries. So like I said, orthopedic injuries is what this kit's made to treat mainly, along with your major life threats. On this side in this loop, I'm carrying just some electrolytes. You have an exhausted hiker. I carry water bottles in my other kit and enough for the patient. So if we're not doing IV hydration, then I can open one of these up, put it in their water bottle and just replenish some of those electrolytes if they've been sweating a ton. And then ideally we'll hike them out. We don't really want to carry somebody out of the trail. You go much more than 500 feet and that becomes a huge pain. So we try to walk somebody out whenever possible. And then additionally on the side, we have two ARS needles. I'm gonna change these out to 10 gauge needles when I get a chance. These are just the 14s. Not that there's anything wrong with 14 gauge needles, just 10 gauges are gonna work a little bit better. Now, lastly, this top little pouch here, this is also removable if you want to take this out. I've got a couple things. Oral glucose for your diabetic issues. Thing of med admin, syringes, needles, whatever you need to give a medication is wrapped right up in here. some tape to secure stuff, and then lastly, I bought a vacuum sealer and it's been a lot of fun to use. I've got 3 IV needles, a flush, and then some start kits in there with J-loops if we're gonna start IVs. I really like it in here because the paper packaging over time gets really damaged. This just protects it from the elements. I cut 2 little slits on either side. You can just tear this open really easily and use the IV kit. So that is what I have in here for med admin. Now you're thinking, well, Sam, you don't have any meds. Why do you need med admin supplies? 2 things that are not in this kit that I will take out of my swap bag because I don't have duplicates of it and it wouldn't fit in this anyways. I'm gonna take my diagnostic pouch, which is just a rip-away container that has my pulse oximeter, blood pressure cuff, stethoscope, and pen light, and I'm going to put that in my search and rescue bag, and then my medication pouch. I'm gonna take that out and put that in the search and rescue bag as well, along with some minor items like your moleskin, basically the things that you would need for hiking through the wilderness. So those are all gonna go in the other kit, and I'm gonna switch them between the 2 bags as I need to, but this is pretty much packed and ready to go for the major things. In theory, I could just grab this and go and treat a majority of life threats in the field. Even though I've been doing it for about 2 years, the search and rescue realm remains relatively new to me, and especially packing gear, I'm not an expert in it. So if you guys see anything that you would change or something I don't have that you would have or vice versa, leave them in the comments down below, and I will see you next week.